Autism, or autism spectrum disorder, ASD, is a multifactorial syndrome resulting from both genetic and non-genetic risk factors, and characterized by challenges with repetitive behaviors, speech, social skills, and nonverbal communication. Pharmacological interventions are mainly aimed at reducing some accompanying symptoms, such as calming, hyperactivity, and sleep, but have no effect on ASD's core symptoms. Behavioral interventions are the mainstay treatment, but have limited effect. Many families pursue dietary and nutritional approaches. In this video, we shall present one such specific promising dietary option for treatment. The most recent statistical incidence rate of autism for the U.S. is now 1 in 40, which would indicate another significant increase from earlier statistics. This may in part be a result of the diagnostic criteria for autism have evolved in the Diagnostic and Statistical Manual of Mental Disorders, 5th ed. revision. Previously separate diagnoses, i.e. autistic disorder, Asperger's disorder, pervasive developmental disorder, were consolidated into one, autism spectrum disorder. Also, the rate has undoubtedly been influenced by the increased awareness of autism in both the general population and the scientific community. When autistic kids get a fever, they often display dramatically more normal behavior, including a greater desire or ability to communicate. They can become less withdrawn, more alert, more talkative, more communicative. This challenges the whole presumption that autism is some kind of static, irreversible brain disorder, where the brain is just inexorably damaged in some way, with no hope of recovery. But the fever phenomenon suggests, no, it may be more of a dynamic brain condition, where the normal healthy circuits are there, but being actively suppressed, and the fever somehow lifts that suppression, relieves the active disorder, suggesting if we could figure out why, we could theoretically relieve it not just for days, but for forever. Crucifers like broccoli potentially prevent DNA damage and metastatic cancer spread, activate defenses against pathogens and pollutants, help to prevent lymphoma, boost your liver detox enzymes, and target breast cancer stem cells, and reduce the risk of prostate cancer progression, but they may also successfully help treat autism. In a placebo-controlled, randomized, double-blind clinical trial, daily oral administration of sulforaphane, derived from broccoli sprouts, to ASD subjects substantially and reversibly improved behavior compared with placebo recipients. No drug or behavioral interventions have ever shown these kind of effects on core ASD symptoms. This has been replicated in numerous other studies. For example, in this work titled Initial Outcomes from an Autism Treatment Demonstration, 80% of ASD participants showed some reduction in core symptoms, and 39% had significant reductions in severity. The authors state, "We obtained remarkable results." This study is also useful in that they specifically used an off-the-shelf formulation of sulforaphane, namely Broccamax, advertised as having 35 milligrams of sulforaphane, resulting in 8 milligrams of actual sulforaphane in vitro. 2 tabs per day costs less than $1. Other off-the-shelf sources of sulforaphane include a stabilized version of pure plant-derived sulforaphane, known as prostophane, contains 10 milligrams of free and stabilized sulforaphane derived from 220 milligrams broccoli seeds. Recommended dose is 2 tabs twice a day, ideally with meals. Each tab costs about $1. Another available product is Avmacol, a supplement that supports sulforaphane production by providing glucoraphanin, an active myrosinase enzyme, which assists the conversion of glucoraphanin to sulforaphane. Recommended dose is 6 tablets per day at a cost of about $4. We have presented a dietary option utilizing sulforaphane, present in cruciferous vegetables, particularly broccoli, which has some indications for possible improvement of some ASD core symptoms. We hope this information provides one possible option for the treatment of ASD.